Good evening, everybody. My name is Bruce Dorr, and I'm one of the staff scientists at Science North. You probably noticed we're a little bit late. There was a slight power failure with some of us, so we couldn't get back on as quickly as we wanted to. So hopefully we shouldn't have any issues from now on. So welcome to the trivia evening session about the COVID-19 vaccine. So I'm very happy that you have joined us. I will be joined by another co-host. Before we begin, I'd like to do a land acknowledgement. So we would like to acknowledge that we are on the traditional and ancestral lands of the Atikamekw, Anishinaabe, and Wanapitei First Nation. I would like also to acknowledge the Métis Nation for their cultural and economic contributions in this area. These lands sit in the Robinson-Huron Treaty Area, and as we are all treaty people, it is important for all of us to be thinking about the treaty area we live in and that we are an active part of. Let's take a moment to appreciate the land that we are on by acknowledging the traditional territory and the treaty area that we are located in. So again, thank you very much for joining us. I will be co-hosting this presentation, and my other co-host, we will get him on right now, Dr. Dennis Wright. How's it going, Dennis?
Good, Bruce. Good to see you. How are you today?
Great. So you are what kind of physician are you?
I'm a GP, family doctor, walking clinic doctor, just kind of a generalist.
Generalist.
I'm not opening people up or anything like that.
Okay. And you've been involved quite heavily on this vaccination campaign, correct?
Yeah, this COVID pandemic in general, I've been involved in swabbing, involved in vaccinating, and even the last pandemic, the H1N1 I was involved in. So it's interesting to watch how it's been progressing.
Okay, well, thank you very much for joining us, because it's great to have an expert like you to be able to answer questions and kind of elaborate on some of these different things that people may have and questions they may have about the COVID-19 vaccines. Before we proceed, if anybody is watching us through Facebook, you will see on Facebook a little click to go to YouTube. We would like you to switch to YouTube, because in order to do this trivia, we're going to use a platform called Kahoot, and Kahoot works a lot better if you watch this on YouTube. So if you can, just switch to the YouTube platform instead of Facebook, and this will work a lot better. So what we're going to do, we're going to use the Kahoot platform. Have you ever used Kahoot, Dennis?
Once. It was a little fun time we had with kids, but I'm not an expert, so I'll look to your guidance to give me a little bit of feedback.
I have another of my colleague, Renata. She's kind of the technical wizard in the background, so once in a while you might hear a booming voice from Renata. If there's a question that somebody has asked that we can answer. And saying that, if you have any questions, please write them in the chat area so that Dr. Reich and I can try to answer them. That's the whole point. We want you to ask questions and that you feel comfortable about the COVID-19 vaccine, so that you are going to make the most appropriate decision when it comes to vaccination for you and also your family. All right, so let's switch to the Kahoot screen. Oh, there we go. So for those who have used Kahoot, you know what to do. For those who have never used Kahoot, you will need another device. So I have my phone right here. I got a computer and phone right here, so you can use your phone. And then just on top, just write this address, www.kahoot.it. And after you write that in, you will be asked for a PIN number, and you just write down this PIN number. Afterwards, you will be able to choose a nickname. So a nickname, a random nickname generator. You can choose your name, and then you will be able to join into Kahoot. One little trick I found with my phone, if you can just change the settings of your phone so it doesn't go to sleep, this will work a lot better. But if for some reason you lose connection, don't worry about it. what's going to happen, this Kahoot web address will be found at the bottom, as well as the game pin. So you can then rejoin later on if for some reason something happens. The other thing also I want everybody to keep in mind is that there is about a 10-second delay from what you are seeing on YouTube and what will appear on the screen here at Kahoot. So suddenly you're going to see your Kahoot on your phone change. You're going to see different colors and symbols. Those are the ones that you're going to choose for the answer, but you won't see the question on the screen right away. It's going to be about 10 seconds later. You're going to have enough time to be able to answer the questions, but keep in mind the countdown that you're seeing on the screen is not the true countdown for you. There's about a 10-second delay. So just keep that in mind. You have to answer very quickly in order to get your answers in. All right. So if you're interested, please enter your PIN number, generate your name, and then we are going to begin. So I'm seeing a lot of comments, which is great. Very happy I'm seeing comments here in our comment session. Very, very good. And again, if you have any questions, we're here to answer your questions. All right, so we're going to start. So the first question is not a very difficult question. It's more of a polling question, all right, just to get a sense of, where you are when it comes to vaccination, okay? And I'm just going to go to the next.
Just get comfortable with how it works, I guess.
That's it. Oh, I lost one of my questions. Sorry. Okay. So first question, what causes COVID-19? Is it a bacteria? Is it a virus? Is it a type of alcoholic beverage? Or is it 5G cell phone towers?
Where's a space laser option there, Bruce?
Yeah, it's not on there. There we go. So it is a virus. You know what, ladies and gentlemen? I just realized that, unfortunately, with the power outage, the wrong Kahoot got loaded. So I'm going to reload the Kahoot. We're going to restart because this is not the correct one.
Well, there you go. Good. It was good practice.
It's always so. I'm going to stop sharing my screen for just a second. Sorry about that. It's just like okay. I just realized it's not the right Kahoot. I just can't believe it. Technical stuff.
Yes.
Case, right?
That was the easy question, Kahoot.
That was the easy question, exactly.
For the little kiddies. Maybe we should have kept that one because.
So let me get the right one here. I'm just going to leave the site. Sorry about that, ladies and gentlemen.
So is it the same? Is it the same pin?
No, it's going to be a new pin. So we're going to have to restart. Right. Give me a second. Sorry about that.
That's okay. Maybe a lot of people had that same power outage that we did, and just give them a chance to get in. There
we go. I'm just gonna get this done. There we go. So I'm going to share my screen right now. Renata is going to show you the window. There we go. Excellent. You know what? I'm going to add a little bit of music to this so that we can have a bit of fun while we are writing in our PIN.
There we go.
There we go. Sorry about that. So let's start over. I'm going to write down my PIN. All right. There we go. All right. It's got a little 80s vibe going here. Okay. All right. Sorry about that, ladies and gentlemen.
That's all right. It happens.
Okay. So, we got more people. Excellent. This is fantastic. All right. Okay. So here we go.
All right. Which one are you, Bruce?
I'm creative otter.
Lovely.
Okay, so the first question is the polling question. How many of you have received at least one dose of the COVID-19 vaccine? Okay. So have you at least received one?
That's good. Yeah. I think the numbers are really high, right, Bruce? In Sudbury in particular.
Yeah, and I'm seeing a lot of numbers also increasing for second doses. I think we're up to 40,000 in Sudbury. So
wonderful news. I think we're above 70% for first doses, and I know we're in the older ages. We're up at around like 90, close to 100% in some of the older ages. So it's wonderful.
Yeah, that's good. It's really, really good. And now that the 12 and up are also involved with the vaccination campaign, we're going to get even that number higher. So that's fantastic. So I see that a lot of you have had at least their first dose, and probably several of you have already had their second dose, which is fantastic.
Yeah.
Okay, so what causes COVID-19? We've done this one. Please answer the question one more time. Sorry about that.
No problem. No problem.
So again, this one was a
Tim,
little easier.
welcome to the chat, Tim.
Yeah.
We'll definitely answer your question as the night goes on.
Ah, there we go.
Yeah, let's see here. What is the answer to this one?
Oh, come on.
Clearly 5G phone towers.
Clearly, it's 5G cell phone towers. Or is it Corona beer?
Corona beer. How smart is our friend? See, somebody else thought it was 5G phone towers.
No, I did not. I just kind of threw it in there. So yeah, it is a virus. And the thing I just want people to keep in mind, a virus is different than a bacteria. Okay, sometimes people get those two mixed up, and frankly, how you treat a viral infection is very different than how you treat a bacterial infection. So it's just something to keep in mind. All right, so let's see the score here. So Magic Raccoon as the top score. So keep in mind for those who've never done Kahoot, it's not only getting the right answer, is who answers also the quickest. So the quicker you are answering the question, the more points you get. All right, so very competitive. This is really good. All right, next question. Oh, before we go to the next question,
okay.
I just want to talk about the virus, right? What it's all about. So this is a diagram. Now, keep in mind the virus doesn't have actual colors. Okay, they put colors so that people can see what it is. So the virus has this membrane that houses the genetic information. It's a genetic information is called RNA. Okay, it's a bit different than ours, but conceptually very similar. And I just want to highlight these spike molecules, these spike proteins. That's what we hear all the time in the news. And essentially it allows the virus to be able to attach to our cells and then get inside our cells to infect it. And then the whole point of the virus is to get this RNA, this genetic material, inside our cells so that it can make copies of it,
right,
and make more and more virus. Okay, so Biology 101, very briefly about viruses.
Very cool. While you're going to the next question there, Bruce, Tim's just asking, what are the risks for an asthmatic? And in fact, at first, everyone thought that asthmatics actually had more risk. But in fact, asthmatics haven't been borne out to be any riskier than the general public. You'd think that with the lungs, you'd have that issue, but it doesn't seem this virus causes any more twitchiness at all. So, Tim, I think you're safe, at least as safe as everyone else in getting this vaccine. So it's one of the questions that was posed by him. So I just wanted to answer that out there.
Cool. Very, very good. Very good. Okay, so here we go. Next, now this is a question. True or false? Do antibiotics work against the coronavirus? Okay, this was a question that now I think most people know the answer, but at the beginning of the pandemic, there was a lot of questions about that because, we have all these drugs out there that cure different diseases, and a lot of people were saying, why don't we just use antibiotics? So antibiotic works against coronavirus. Is that a true or a false statement? All right. Excellent. Yeah, it is a false statement.
Good. Hey, we got a great, very smart crew here.
So can you explain to me a little bit, Dr. Wright, why an antibiotic would not work against a viral infection?
So the important thing to realize about the difference between bacteria and viruses is bacteria carry everything with them that they need to replicate. All they need is food, right? All they need is sugar or some sort of energy source. Viruses basically hijack our bodies or our engine to make more virus. So antibiotics, we can throw wrenches into the machinery of a bacteria to basically clog up and divert and destroy its mechanism of replication, and make it less virulent or less infectious. Versus viruses, it's hard to throw wrenches into the machinery because they're using our machinery. So that's why viruses are a little more difficult to kind of get a hold of or to slow down, because they're effectively using us. And anything that we use to kind of stop the virus from replicating, you're stopping your own cells from using their machinery. So it takes a little more subtle tools to do the trick.
And that's why when somebody comes up to you with, a viral infection, you don't prescribe antibiotics. They go back home, they rest.
That's exactly right. That's exactly right. And science is getting to the point where we're starting to get, very good antivirals, but only for certain viruses, because you have to catch them at the right time when they're doing something that's unique to a virus.
Good point. All right, so here we go. Ooh, expert.
That magic raccoon is really magical.
Very magical. Excellent. All right, so next question. Here we go. Which is produced by your body to stop viruses? Are they antibodies? Are they antibiotics? Are they probiotics? Or are they viroids? What is being produced by your body to stop viruses? Okay. Again, this is more nomenclature. This is more definition. This is just getting the right terms. And there's definitely one of these terms that we hear a lot in the news, especially when we come to vaccines. They look at this, the amounts of this. Yep. So they're antibodies. So when we hear, people get vaccines and the antibody titer counts, or the amount of antibodies in the body, that is an indication of how good the vaccine works, right? It gives an indication of what is. I mean, the immune system is a lot more than just antibodies, but it is a component to be able to fight viruses. So,
yeah, I kind of think of antibodies like little mini beacons, right? They attach to a very specific part of the virus, and it calls the body's immune system to come and attack it, right? Or whatever it is that it's blinking. It's saying, "Come and get me." That's what the antibodies are doing. Yeah. And when they talk about this Delta variant and how the vaccines don't work quite as well against it, it's because the beacon doesn't fit quite exactly right, that the virus has changed its shape slightly so that the antibody doesn't stick as well. So it's allowed to kind of sneak through and kind of get into the cells and replicate.
Yeah. Although the vaccines do seem to have an effect, right? From what we know.
Excellent effect. Yeah, especially and with the Delta, they're talking about the Johnson & Johnson one that is having a little bit of difficulty because it's only one shot. But we don't have too much of that in Canada, so it's I think we're pretty good position, in fact, moving forward. Yeah.
Excellent. Okay, so let's see right here. Ooh, expert ibex.
Expert ibex. Who is that guy?
I don't know. Or girl.
Tricky. Or girl. There you go.
Right. Excellent.
Yeah. Ibex can be both. And what happened to Magic Raccoon? Magic Raccoon is still there.
A little bit. It's all a question of how quickly you answer sometimes.
Yes, that's true.
All right, here we go. Next quick question. How does a vaccine work? Does it contain chemicals that destroy a virus? Does it add vitamins to your body so your body can fight a virus a little bit better? Does it contain an antivirus that stops a virus from making us sick? Or does it contain parts of a virus to prepare your body to fight an actual virus? So, I need to answer here.
Yeah, he was coloring it.
So how does a vaccine work?
Yeah, while they're answering, Tim asked a question. He said, who's accountable if there's side effects from vaxes? And at the end of the day, there's no body that's going to hold anyone accountable, because we are in a pandemic, and obviously the risks associated with getting the vaccine are much lower than the risks of the side effects from getting the actual virus, and even some of these newer side effects that we'll talk about later actually are really, really rare. Mm-hmm. So and if you do get a side effect, it's mostly fleeting. It passes very quickly. But just wanted to answer that question from Tim in case he was waiting for the answer.
And correct me if I'm wrong, I think the federal government has a support program if people have had effects. Like they said right at the beginning there'd be some support for that. So I'm not quite sure about the status of that, but there is some support of something. Because, they wanted to make sure that people felt comfortable about taking the vaccine. So,
absolutely.
So how does the vaccine work? That's it. It takes a portion of the virus. Now, previous vaccines actually took, a virus that was like destroyed or very weakened, or a portion of the virus, and it introduces it into your body. So your body kind of reacts and is like, whoa, what is this all about? Mounts a immune response, defenses, as if it's fighting a natural deadly pathogen virus, so that when a real virus comes in, it's ready to go. It's ready to neutralize that virus. Very, very good. All right, so excellent. So there we go. Eager hair. Excellent.
Wow, eager hair.
Excellent.
Northern Lights, you get bragging rights to all your friends if you win.
Very good. Okay, so I'm going to use the next few slides just to explain how these vaccines work, okay? So we're going to start with the mRNA vaccine. This is the vaccine that you heard with Pfizer and Moderna. So how it works is, here's your coronavirus. And what these vaccine makers have done is they've taken a small portion of the RNA of the virus, okay? This portion that codes for the spike protein. So they don't even take the whole genetic information of the virus, just a small portion that codes for that spike protein. And one thing, to make this genetic information right here, they don't even need to grow the virus. They can actually make this in a lab, all right? So that was why, you know, these vaccines were developed. One of the reasons why they were developed so quickly is because we knew the genetic sequence of the virus. They kind of decoded it, and they said, aha, we're going to take this section and we're going to use this section to make a vaccine. Okay, so the section that codes for the spike proteins. Then what they do is they take that piece of RNA, okay, that genetic information, and they put it into a little fat globule, which we call a nanoparticle. So I just want you to think of fat globule like, you know, when you take salad dressing and you kind of mix it up and you get these little blobs of fat. That's really what it is. It's just tiny, 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 all right, microscopic. And they stick that RNA in there. And the reason for that is when these RNA vaccines, you know, they were first started to study them, they found that, you know, the RNA is not stable. It just breaks down, wouldn't be taken up by our bodies really well. So really what these fat globules are, these nanoparticles act a bit like a mail carrier. It will carry that genetic information to then bring it to our cells. So how does it work? So essentially what happens, there's the vaccine, the genetic information goes inside your cell then uses that genetic information to produce the spike molecule, and then the immune system will see this and say, whoa, that doesn't belong to me, and then will mount an immune response towards it, okay? So essentially, what this vaccine has done is using our cells to produce one component, one little component of the virus, not the whole virus, just one component, the component that the immune system will recognize as being something that doesn't belong and will attack if a real virus comes into our system, all right? So it's quite ingenious. It's quite ingenious. This piece of genetic information that goes into your cell, you might say, well, why would the cell use that? Is that something? Well, RNA is RNA, whether it comes from a virus or it comes from even our cells. The cell doesn't really distinguish. It just reads that piece of information and builds whatever it needs to build based on that information that's there.
That's exactly right, Bruce. And if you think about what would happen if the real virus entered your body, is that little sequence is actually much longer and codes for the entire virus. So then that virus can then go into your bloodstream and infect everything.
Yeah, the virus would go in here.
And it goes into your DNA, destroys the cell, absolutely. And this particular virus is very insidious in that you have just one cell here that it's infecting. But what this virus does is doesn't just, some cells like the flu virus actually swells the virus and explodes and releases all the virus. This one actually can break the walls between cells and kind of like knocking apartments across. So it evades the body system a little bit. So that's why it's important to kind of get that component that your body recognizes as foreign, which is the spike protein. That's exactly right.
Excellent. So that's the Moderna and the Pfizer BioNTech. The other one that is approved in Canada are the vector vaccines, so which we call AstraZeneca and the Janssen. So again, they take this genetic information of the virus, but instead of RNA, they transformed it into DNA. I'm not going to go into much detail with that, but they just kind of put another section, another helix to it. Again, don't worry about it. And again, this codes for the spike protein. Now, the reason why we do this, more or less, is that DNA is more stable than RNA, whereas the RNA vaccines, you have to store them at -70 degrees Celsius. These, you can store them at, just your freezer temperature at -20. So it's a much more stable type of a vaccine. And then the next step is, instead of using that flat globule to carry that genetic information, they take that genetic information and put it in an adenovirus. It's a virus that causes colds in humans, okay? And some of these adenoviruses, even take an adenovirus that don't affect humans, they actually affect chimpanzees. And then some of you are like looking at me, oh God, is this the beginning of the Planet of the Apes? What is this all about, Bruce? No, you do not have to worry. This viral component is completely inactive. They've taken all the genetic sequence to make more there's no problem, okay? It's not going to make more viruses. It just carries the genetic information of the coronavirus that codes for the spike protein.
In a real sense, think of it as nature's little fat globule that was in the other description that Bruce gave, right? This is nature's way of encapsulating and protecting the DNA so it could propagate itself.
Yeah, and then the other thing also that they said about these type of vector vaccine is that because you're bringing in this capsule of a virus, that it would actually stimulate your immune system even stronger. So there's a double good component with it. It's more stable, and your immune system would react a little bit better to this to stop. But the same thing happens. The genetic information goes inside your cell. Your cell then produces, again, the spike proteins, and then the spike proteins, again, are shown to your immune system, and then your immune system builds a response to stop, the spike proteins, to attack the spike proteins, and eventually an actual virus. So that's how these work, okay? Now, one thing I want everybody to keep in mind, this type of technology right here, this is actually pretty old. This is like over 40 years old. Whereas the mRNA technology, they've been studying it over 15, 20 years. Okay, so this is new for what we're doing, but tell you the truth, you know what? This has been well studied. So it's new to us, but it's actually not that new for scientists. This is a type of science that we have been using for many years. We have just now perfected it to use as a vaccine for humans to fight the coronavirus. And I think it's going to be a game changer in the future, how new vaccines are going to be created. So this is excellent way of producing vaccines. All right, I'm just trying to see if there's any questions. Does anybody have any questions? Does any audience member have any questions on how these vaccines work to get your immune system going? No? All right, that's fine. All right, so let's go to our next question. True or false? Can these mRNA vaccines create viruses? So mRNA vaccines can create viruses. Is that a true statement or is that a false statement? So is that a true statement or is that a false statement? And that's actually a question that we had in January when these vaccines actually came into Canada. I know I've had several people ask questions about that. So it's actually false. So why can't these vaccines create viruses, Dennis?
Well, because the blueprints don't have the virus in them. They just basically, it's like saying, can a blueprint for a bathroom create a house? Well, no, it's only for that one portion. So the blueprint is not enough. There's not enough knowledge there to be able to do it. Would that be a good answer?
I think that's a good answer. Yeah, we don't have all the genetic information, so it's only a small portion, not all the RNA of the vaccine. So yeah, you're not creating any viruses. You're only producing those spike proteins. All right, so let's see where we're at right now. Excellent. So we got 3 players on a 5-answer streak. Very good. All right, next question. True or false? The vaccines, whether they're RNA or vector vaccines, can change your DNA. Is that a true statement or is that a false statement? The mRNA and vector vaccines can change your DNA. And again, I had that question asked to me. And you know what? I got the answer directly from AstraZeneca for this one. I contacted them and they explained to me that it is false. It does not change your DNA. Now, for those who were kind of looking at those diagrams and how things moved around and things like that, some of you probably noticed for the AstraZeneca and the Jensen, the DNA went into our nucleus where we have our DNA. And that's where people were kind of worried. Can it go inside our DNA? And they told me, no, it doesn't integrate within our DNA. It doesn't go part of our DNA. And then the mRNA as such, well, it gets degraded in our cells and it doesn't even stay. It just gets broken down. And eventually our cells in our bodies, well, they die and they get replaced by new cells, right? So what happens, the cells that may have that virus DNA in it, that's not part of your DNA, just sits there. Well, when that cell dies, well, that viral DNA is also gone. So it doesn't stay forever.
That's exactly right, Bruce. And it's interesting because if you look at, you know, the evolution of humans, in fact, because the mRNA viruses, as you said, don't go into the cell, but there are viruses that actually, or portions of virus that can be taken up by the human body. In fact, like upwards of close to just 10% of humans' DNA is historically over evolution, long time, could be due to viruses. So it's interesting. But in this case, it's not something that gets attached. So it's a very safe vaccine.
Now, I just want to add one point to this because some people were afraid that it would change your DNA and all types of that. It will not affect your fertility. So these vaccines do not affect your ability to have children. So it doesn't affect, you know, your eggs or your sperm and things like that. And if you are pregnant, this will not affect your developing fetus, right? So you don't have to be afraid to use the vaccine. They are safe for that, okay? Because people were thinking it would change the DNA, especially if you're developing fetus, and that's not the case.
I had many people ask me, and they said, why would Pfizer be asking in the clinical trials? They're asking people who are, you know, potentially having babies to report these things. And it's for the very reason that, you know, they're taking safety to the extreme. They're basically saying, we want to know if there is any potential. And there's been millions of doses given, and the clinical trials that were done didn't show anything.
So anyways, very safe, very safe. It's not going to change your DNA. You're not going to start growing spike proteins everywhere. You're good. All right. So let's see right here. Oh, IBIX. They taking the lead again. The scores are so close. Look at that. Really close. It only takes a couple of questions, and next thing you know, you're way ahead. All right. Next question. Here we go. We hear that these vaccines contain nanotechnology. What is it? Are these microchips that will track you everywhere? Are these little microscopic robots that will control your thoughts? Are they little fat globules that carry those genetic pieces of information? Or a type of medicine that will destroy the coronavirus? So we hear these different terms, and unfortunately, some people use this incorrectly to scare people from taking vaccines.
Well, they can also attach spoons to their noses and keys to their necks, and that's very, very useful.
Yeah, so at the beginning when these vaccines were coming out and scientists were talking about these nanotechnology, those nanoparticles I mentioned, those fat globules, unfortunately, they then took that word and then it went woo really, really far and in explaining, you know, it's like Bill Gates that was using that to control your mind and all that stuff. It's a little fat globules. That's what it's all about. So, but imagine if we could make robots that small. I mean, for crying out loud, I wouldn't use robots to control people. You would use it like to maybe get rid of cancer cells or
break down plaques.
You could just imagine what we could. We're not there yet, so no, it doesn't contain any of that. All right, so here we go. Arctic Panda. Wow.
Moving on up.
7 correct answers in a row.
Ooh. Panda.
All right, quiz. Oh, there's more than one answer for this one. So what are the side effects of vaccines? Headaches, fever, muscle pain, loss of sense of smell. So what you need to do, you answer more than one correct question, and then you hit the submit button to submit your correct answer. So there's more than one correct one in this one. Now choose which one you think it is. There we go. And then hit the submit. If you don't hit the submit, It won't go in. There we go.
It was funny. There was a side effect very early on, Bruce, that people had COVID toes, and we saw a few of those very early on because I worked beside Dr. Slemkovich at the Aquiline Clinic, and she was seeing them. They look like red, almost like frostbite on your toes, and we saw some of those early on.
Was that from the vaccine or from COVID?
No, from the infection.
Yeah. Okay.
Yeah. No, the vaccine.
Yeah.
Yeah.
I heard that. So,
but the vaccine can cause it in rare cases too. But it's harmless. Harmless. Yeah.
So loss of sense of smell, that's the actual virus that causes that. The vaccine doesn't. So here's my question to you. So somebody gets vaccinated and they may show all these symptoms or one of these symptoms. What does that mean? Does that mean that they actually have COVID-19?
Sorry, the question was?
The question is, if anybody's showing any of these side effects, does that mean that the vaccine is giving them COVID-19? What's going on? Well, why are they having these side effects?
Oh, well, that's your body responding to the spike proteins, right? So what happens is typically you get these symptoms initially when your body sees a foreign substance. So what happens is your body, typically, the reason you get fever is your body makes white blood cells, which make antibodies, better in a higher temperature. Okay, so as the temperature increases, your body makes antibodies better and faster. That's why we don't typically have it at the temperature, because you expend a lot of energy to keep your body temperature high. But in an infectious situation, you do. Muscle pains and bone pains you get because a lot of the white blood cells are made in your bones from your bone marrow. So what happens is your bone marrow starts to swell, and the pressure of this white blood cells escaping into your bloodstream causes bone aches, right? And then the headache is just basically due to the fever and the change in temperature and everything else that goes along with it. So they have specific reasons that these happen.
So if somebody has these side effects, I mean, within limits, you don't want a fever that's 42 degrees Celsius, but if you have these and they only last, I think, like 1 or 2 days max.
That's right. That's exactly right.
It's a good sign. It means the vaccine is actually stimulating your immune system to get.
You're doing what you're supposed to be doing, and your body's doing what it's supposed to be doing. And in fact, some studies now are showing that they used to say, okay, come to your doctor when you get your vaccines, regardless of whether it's COVID or any other. Take some Tylenol, take some Advil. But now there's a movement to say, you know what? Don't tell your body, don't worry. Like, no, don't take Advil and Motrin if you don't need to, because that tells your body, relax, don't worry, don't pay attention to that thing. But you really want it to. You want to respond. So there is, mounting evidence that, let your body have those side effects, if you will.
Okay, cool. That is pretty good. So it's a good thing. Now, people like me that took the vaccine, I didn't get any effects. The vaccine still worked on me. I didn't show any of these symptoms.
Absolutely.
Everybody's different, right? So
absolutely,
that's what it is. So yeah, Jen mentioned, what happens when people that get it back? The vaccine still work, but for whatever reason, some people will show these side effects, and other people they don't. And in fact, the people that do show side effects are a minority. The majority of us don't even show any effects. So
that's exactly right. And there is no correlation between antibody production and side effects. So it's interesting.
Okay, so here we go. Let's see where we're at right now. Arctic Panda took the lead. Excellent.
There goes Panda. How come Arctic Panda had a little flame beside it before, but now it's
so what happens in a little flame? Well, it could probably still have the flame. It just means that it's on a hot streak.
Very cool. Very cool.
All right. So next question. Again, more than one correct answer. Hit submit. What are the long-term effects of COVID-19 vaccines? So are you going to start growing hair and eating bananas?
That's why, Bruce, you like that one, right? You want that side effect.
Permanently lose your sense of smell or taste, being protected against COVID-19, or no negative effects have been detected after 1 year using the vaccine. So which one is it? Which one is it? So there's more than one correct answer. Don't forget to hit the submit so that you can submit your answer. All right, so here we go. So the answer is, there's the two last ones. So we've been, well, not we, but the vaccine makers have been testing and have been using these vaccines since last April, and there has been no negative effects really detected. I mean, major negative effects. We're coming to that. And in fact, one of the side effects, and somebody kind of pointed out to me, you're protected against COVID-19. That is the side effect of the vaccine. It actually works against the disease. So if anybody asks you if there are any long-term effects of COVID-19 vaccines, yeah, they protect you against the disease. Now, from what I understand, maybe correct me, Dr. Wright, but from the 70 plus years, I mean, we've had vaccines and we've tested vaccines, any long-term effects tend to happen like a couple of weeks, so maximum like 2 months, right, after the dose. And then Health Canada approves vaccines like almost 6 months after these have initially been tested. So, I mean, we really, make sure that there is no long-term effects. And if there's any, we should have saw them like, right at the beginning when people were using them. So, you know what? I don't think we have to worry about these ones.
Yeah, and you know what? If you look at these kinds of vaccines, yes, they're relatively new, but they're based on very sound science, right? You're basically getting the vaccine on particularly on the RNA ones. You're actually just shortening the cycle or what happens in a natural vaccine. You're kind of like having it. You're getting to where the machine is making the spike protein midway, and it so it really should have no other side effects. Yeah, that's right.
Great. All right, so here we go. I see Arctic Panda hot streak again.
Yeah, I had a couple of people, Bruce, asked. They went to the Kahoot, they put in their code, but they don't see the questions. That's because they should be going to YouTube to see the questions, correct?
Yeah, because what happens is that if they're on a Facebook, the time interval is so long. So please go to the YouTube link, and then it's actually on the Facebook.
That's right.
Just click on that because the delay between YouTube and what you're seeing on Kahoot is only about 10 seconds. So it'll work a little bit better.
That's right. And share the link with your friends in case they don't know how to get it.
Yeah. And then if you haven't signed up, you can go. The Kahoot is right here, and the PIN number is right there. All right, so let's go quiz. Again, multi-select, more than one questions. Which of the following is seen in a very small number of vaccinated individuals? Do we see myocarditis? Do we see blood clots? Do we see individuals that become infertile? Or do we see magnetism in some of these?
It's a tough one. Bruce, you're really making these questions difficult.
Yeah.
Oh, but we have very smart people. Look at that.
Excellent. So, hot topic right now, myocarditis. I'm leaving it up to you.
Yeah, this is an interesting one. And in fact, in Canada, the numbers are at the same rate of expected myocarditis if there was a pandemic or if there was a vaccine or if there was anything else happening. So really the numbers of myocarditis or pericarditis. Myocarditis is an inflammation of the muscle of the heart, and pericarditis is an inflammation of the covering around the heart. And so if you look at the rates of occurrence, and they're very low, like they're in the tens, right? So it's like at this time, they're not spiking, pardon the pun, spiking in any way. That said, in Europe, in the UK, they are seeing some slight increases. And just like blood clots, the theory is that the spike protein itself, aside from just the virus, because the spike protein may have an inflammatory effect. And so that might be why it's happening. But again, these are transitory. Except for the blood clots, obviously, in which case these rare things do happen with certain genetics. But the myocarditis is transitory, it passes, and there's been no complications in Canada from it. So there's no, your risk of getting COVID itself is much higher than it is from anything from.
And COVID could cause myocarditis pretty bad.
Oh my goodness, yes, absolutely. Because again, you have the spike protein potentially that is doing what it's doing, but it's getting into your cells. Your viral loads are much higher. And so they're starting to believe that COVID is not a respiratory disease; it's more a vascular disease. Oh. So it's as we learn more about it, we'll get better and better at it.
So just to give you participants, just give you some perspective, I saw a number just today. In the United States, they've vaccinated 26 million individuals, young individuals, and out of those 26 million individuals, they came up with 320-ish type cases of myocarditis. So it's very small. A lot of times it tends to be younger people, and pretty much they recover with it very, very quickly. They don't even need to go to a hospital. And being young, you tend to recover much quicker. So again, the chances of being really sick by COVID-19 is very high, and they still recommend, individuals 12 and up get vaccinated, and the Pfizer vaccine is very effective.
That's right. Side effects of the myocarditis typically is a little bit of mild chest pain and shortness of breath, and it responds very well. Again, just like with a sore arm, if you're really struggling with that, a little bit of Advil or Motrin, and you're good to go.
Yeah. I don't even know how many people in the United States ended up in hospital, but it was such a small number. And then,
there was no deaths, and I believe all of them recovered fully.
And keep in mind, this is not just the United States. Even Israel, where they had the Pfizer vaccine, they noticed, some, but we're talking a couple hundred. We're not talking, tens of thousands of individuals getting it. So very good vaccine against that. All right, excellent.
Panda is just rocking it.
Rocking it right there. All right, so next question. So vaccines are tested on people before Health Canada approves them. Now, how many people have these vaccines being tested on? About 500 people, 5,000 people, 50,000 people, or over 100,000 people. So how many people have?
And again, Bruce, this is before they were approved, right?
Yeah, before they were approved. So how many people were these tested on? So when we took all 4 vaccines together, over 100,000 people that these vaccines were tested upon. Okay, so lots and lots of people. All right, we're not talking, they do a couple hundred here, a couple hundred there. And not only do they test them on over 100,000 people, but people of different sexes, different ages, different races, different continents. They try to get this wide gamut of people, because it's no good for the vaccine to only work for one age group and doesn't work for the other age group, or maybe one sex and the other. We want the vaccine to work for everybody, and that's why they test on so many people, because they're testing on 2 things. They're testing safety, and they're testing whether or not it's effective. Because I think there's been vaccines that they haven't been effective, right? When they first started with these vaccines, I can't remember.
In fact, there's been a tremendous number that have failed. GSK had 2 failed in the UK. These are big pharma companies that spend vast amounts of money. So they have failures.
They have failures, and they don't go on, and they try something else. Okay, so
that's right.
Many people, and right now for the Pfizer vaccine, and again, I'm talking about the younger people, over hundreds of millions of people have been vaccinated, and again, very, very effective against COVID-19. All right, so here we go. Arctic
there goes Rhino. Rhino's coming after the panda.
Yeah, very good. Very good.
Eager hair's on a bit of a nice streak.
Nice streak. So I just want to kind of go over a bit how vaccines are approved and the timeline. So here's a historical vaccine approval process. There's different steps that need to be followed before Health Canada approves it. Again, I'm not going to go into too much detail with it. There's some research, then there's different types of trials before it gets approved. It needs to hit certain types of standards and marks before we go.
And as you go to the right, it's more and more people.
Yeah.
So on the far left, you've got safety trials. Yeah. So on the far left, you've got safety trials, very low numbers of people. They actually monitor them for days after, every vital, blood pressure, everything. They actually keep them in hospital in many cases. And then as you move up, they go to dosing studies where they look at different doses and things like that.
And then you get like tens of thousands of people being
That's right.
tried when it comes to a third trial. So here we go. Let's just give you a sense. So academic research, essentially, it can take a couple of years because they need to study the virus or the pathogen to see what it is, because they have to figure out what it was in order to build whatever vaccine they need. So it can take a few years, and there may be many labs that work on this at the same time. Okay, so it's something to keep in mind. All right, so the next part, oops, what's going on here? Okay, so resume. I don't know what's going on here. Okay, the second step is that they then try it on animals. Okay, so there's different animals that are good models. They have immune systems somewhat similar to us, and then they will try these vaccines to see if they work and if they are safe. Okay, obviously, if these animals, there's no, change in antibodies or anything like that, well, they're not going to continue, because if it didn't work on the animal, the chances it's going to work on a human is not very good. And then this is the first trial where they're checking it, and these are usually healthy individuals. They want to see are these vaccines safe, and will they elicit an immune response? And just a few tens of individuals in which this is tried on. Then the second trial, you'll be a few thousands of individuals, and then they kind of like you said, look at dosage. They might start using different groups of individuals to see where. I mean, you see the total time, it can take years for this to happen. And then the last trial, the phase 3 trial, then it really encompasses a whole bunch of individuals, and then we're looking at tens of thousands of individuals, all right, to get there. And that can take several years for this.
It's a really good summary. That's great.
A good summary. And then at the end, when all this data is there, the data is then sent to Health Canada, where they're going to look at all this data. They're going to look at the manufacturing plants to make sure they have certain quality standards. They even look at the people working there. They have a certain level of education, so on and so forth, to make sure that, first of all, does the vaccine work? Is the vaccine safe? And can the company produce vaccines that will work really, really well? Okay, so things like that, and that's how it works generally when we come to vaccines. Now, that being said, the vaccines that we have right now for COVID-19 were developed much, much quicker. So here's my question. Which of the steps were skipped when it came to the COVID-19 vaccines? Were the phase 1 trial skipped, the phase 2 trial skipped, the phase 3 trial skipped, or none of the steps were skipped? Because these vaccines didn't take 5 to 10 years to be fully developed and approved. It took under.
That's a tricky one, Bruce. That's a tricky question.
Tricky question.
And it's not all of them. Oh, look at that. Good answers.
So no steps were skipped. And then you're thinking, what? So let's see who got this right. Okay, and I'll explain in a second here. Why? Ooh, silver rhinos really gone up. Okay, so here we go. So this is the timeline when it came to the COVID-19 vaccine. And I'm going to explain a little bit why it was developed and why it was approved so quickly. So first of all, whenever they do vaccine trials, it takes a lot of money to do it, okay? And the pharmaceutical companies, they have to talk to their shareholders. Is it worth it? A lot of red tape, blah, blah, blah. Well, with this, the government's put a lot of money, pre-orders and things like that. So right there, right, there was a lot of incentive for the pharmaceutical companies to develop this very quickly. They had the money because a phase 3 trial, it's very expensive to do. So that was that. Here's the academic research. Well, they knew about the coronavirus a lot because we dealt with a coronavirus pandemic years ago, almost 20 years ago, with SARS. So what we learned with SARS, we applied with the SARS-CoV-2, the one that caused COVID-19, and we used that as a template to know what we need to do to attack it. So the academic research only took weeks. We knew what we were going to go. They had done a lot of research. Okay.
Yeah. In fact, it's a source of some conspiratorial discussion, right? Where they're like, oh, it's Wuhan, and it may be something happened there. But at the end of the day, the reason they're doing the research at Wuhan is because that's where the bats are that a lot of these coronavirus come from.
Yeah. And then when we look at preclinical trials, because they knew so much, the preclinical trials actually happened very quickly, just a number of weeks, again, because they had the money. They had the resources to really try on these animals, do whatever they needed to do. And then when they did the phase 1, phase 2, phase 3 trial, you see there's some overlap here that's happening right now. So they did the phase 1 trial when they were very confident that this vaccine actually worked. Before waiting the end of the phase 1 trial, they started phase 2. And then the same thing happened when they were confident with phase 2, they then started phase 3. So they kind of did some overlap, and that saved a lot of time, okay? They still follow the same protocols, they still follow the same procedures, they still look at the safety and efficacy, but it was kind of done in an overlapping fashion. And if you look at phase 3, you say, wow, Bruce, that seems kind of short. It was still 6 months, but the reason why they were able to do it 6 months, because they had lots of money. Okay?
Well, the key, yeah, and the key, Bruce, is that, as you said, these corporations normally wouldn't advance until they were sure the previous phase was okay. But the governments were saying, we will backstop you. So please proceed with everything. In fact, many factories were started to build some of these vaccines that failed their clinical trials. And so the governments effectively wasted some money, but these corporations didn't worry about getting it wrong. They were moving everything at rapid speed.
Yeah, that's it. They were building factories even before the phase 3 trials were done. Now, what's really interesting with this vaccine, most vaccines, what happens, the pharmaceutical company gets all the information and then sends the information to Health Canada at the end. But what Health Canada did to fast track the methodology, the approval process, they kept saying to the pharmaceutical, send us your data as you're getting it. And then reviewers could then look at the data, examine it as each phase trial went from one step to the other. So they didn't get all the information at the end, and then it took months to analyze. They started almost from the beginning when these vaccines first started, and they were looking at the results throughout. And that's why at the end of phase 3's trial, it was just a matter of weeks. Now, if met all the standards that we need to, they could get approved. So no steps were skipped. The same number of steps, the same safety protocol, effectiveness, they were still looking at that. It's just because of lots of money, overlapping the steps, and kind of getting the approval process almost at the beginning when these the data came in, sped up the whole process that we ended up with vaccines under a year, which is phenomenal. I can't imagine. This is just the fastest I've ever seen this. So that's why these COVID-19 vaccines appeared so quickly, okay? They are safe. They have followed the same safety standards as other vaccines. It's just a time period was just kind of compressed. And I always tell people, you know, how can I compare this to something? And when I was young, there was the Jehovah's Witness that lived not too far from my house. And they built their I don't know if it's a synagogue or a temple, I'm not sure what you call it, but they built it in one day. I couldn't believe it. And essentially they pour the pad, the foundation, you know, it sat there for months. So this is like the academic research that was like pre-done. And then they built the walls, everything. And as they were building, inspectors were in there, making sure everything was done correctly. And as inspectors, okay, the structure was good, then the electrical system was going in, and then another inspector comes. So as one thing was being done, another thing was happening, and they were able to build that in 24 hours. So it's just to show you, you know, when you have enough resources and enough money and enough people working on something at the same time, you can really shorten the time in which a vaccine.
Absolutely. And what's interesting about this is that there's, if you think of it as a horse race, you know, we know about what, 5 or 6 different vaccines. There are literally probably close to 60 or 70 companies trying to make a COVID vaccine at this time, you know, we only see the 4 or 5 that are at the front, but there's a lot of people that are still vying for an ability to kind of get that vaccine in there. But the government's only funded certain numbers, the ones that they figured would do well.
Would do well. And guess what? I'm pretty sure within next year, there's still going to be other vaccines that are going to come out that will be approved, and it will be different. There's one vaccine made by a company out in BC that they're looking at to make it as a pill. So people will win. And you could just imagine in countries where refrigeration may be an issue, you just have these pills, right? The pharmacist can give that vaccine, and it would be very easy. So The research is still ongoing. It hasn't stopped. It hasn't stopped. All right. So next question. Oh, this one has more than one correct answer. So will we need an annual shot for the COVID-19 vaccine? That's a good question right now. Yes, no, I don't know. Scientists don't know. There's not more than one correct answer for this one. And this will be a question, especially, as more and more people are getting their 2 shots, as we are looking forward, will we need, I take the flu shot more than one. So really, all answers are correct. Maybe, yes,
Who
no,
knows? Yeah. Yeah, I wonder if they're going to make because the colds are coronaviruses. So I wonder if they're going to be able to find something that'll help with the common cold. Wouldn't that be incredible?
That'd be incredible. And really, the reason why they don't know is because it's such a new disease. It's simple as that. We don't know where it's going to go with that. So this is the whole point of science. We're learning all the time, and based on where the virus will end up, then we might have to have it, or maybe only every 2 to 5 years, or maybe just a booster like we get with our boosters every 10 years. We just don't know. We just don't know. So
the reason the flu you need it all the time, or flu shots every year, is because it combines in chickens and in pigs and in human. Like, so the pieces are always rejigging, almost like a Lego set that's always moving around. So every year there's a potential for a different flu virus. So we tend to get booster shots every year, or new flu shots. With this one, there is some potential for backflow into other animals where it might recombine, but it's more natural changes, right, Bruce? That the spike protein might change a little bit, and that's why we might need some booster shots. But we don't, as Bruce said, we don't know.
We just don't know. The flu virus changes a lot more than what we're seeing with the corona, and that's why we need a flu vaccine every year. But this one, we don't know. We just don't know. Let's wait and see. All right. Next question. Which of the following can cure you against COVID-19? Ivermectin, hydroxychloroquine, vitamin D, or none of the above? And when I mean cure, I mean get rid of the virus, that you will no longer be sick. Which one will completely get rid of it? It's none of the above. Now, I don't think we need to talk about hydroxychloroquine. That one has completely been debunked. But the other two, can you kind of add to those two?
Yeah, there's some really interesting studies coming out of India, South America, and on ivermectin. Ivermectin has a theoretical method of action that stops it from being able to get into the nucleus. And I'm not a conspiracy guy or anything like that, but I think that when we look back in time over this, and I think we're going to see ivermectin definitely has some activity against this. And what's the problem with ivermectin is that it's cheap. Merck makes it, and there's not people jumping all over it to kind of do research on it. So some of these studies that are coming out from smaller countries, or at least countries that might not do, official double-blind placebo-controlled trials, but they're starting to come out and they're starting to show some evidence. Vitamin D is an interesting one. And what's interesting about vitamin D is that if you get a bad outcome with COVID, and they do studies on what your levels of vitamin D are, they tend to be lower. Now, that doesn't mean it's causative. In other words, it doesn't mean that the vitamin D caused you to actually get worse COVID, but it is an interesting cofactor. So it's like, there's nothing wrong with dosing up your vitamin D and taking it, because we should have normal levels of vitamin D. And in fact, the government says don't even test people in Northern Ontario and Sudbury for vitamin D deficiency, because we're all vitamin D deficient, especially in winter. So everyone should be dosing up on their vitamin D, or finding ways to get sunshine, moving to sunnier climates, I guess. But it is an interesting one. So both of those are something. And recently a hydroxychloroquine study came out with some positive effects. But I agree with you that of the three of them, It's not one that I would recommend. But I'll tell you right now, that ivermectin one there's a little smoke, and sometimes when there's smoke, there might be fire.
Yeah, and that's the whole point of science. We're always learning. Now, keep in mind, there are some scrupulous individuals that will say, for example, vitamin D will completely cure COVID-19. So we got to be a bit careful with those statements. But like you said, people that might be low in vitamin D, if they do up their dosage, they could potentially have less, symptoms when it comes, if they happen to get COVID-19.
Absolutely. And I think if there's one message aside from COVID, I would say that a lot of studies are showing that there's something related to low vitamin D and multiple diseases, including things like MS and other things. So if you're going to grab one vitamin when you go to the grocery store, that especially in the winter for you and your family, I would say take some vitamin D.
Yeah. Actually, they add vitamin D to milk. So if you drink milk, you're getting vitamin D. So that's another thing to keep in mind. All right, so here we go. Ooh, new changes, but the scores are really high.
Yeah, they sure are.
Doing a great job. All right, so next question. Which of the following is false about the variants of concern? Variants can spread more quickly in a population. I want the false one. Variants can spread more quickly in the population. Vaccines are ineffective against the current variants. The virus variants can enter and infect your cells more easily. Or variants appear in a population that have a high number of infected individuals. So which of these statements is false? False. Ooh, I didn't answer. Did I get an answer? There we go. So the statement that is false is that the vaccines are ineffective. And we actually talked about the Delta one and the vaccines still protecting individuals against, the variants of concern. So can you explain very briefly, without going into too much evolutionary biology, but how do these variants of concern appear? How come we ended up with all these four of concern, right?
So every day, interestingly, every hour, the viruses are mutating or changing because errors in replication, like reading a book or writing a book. If you got like 100 people or the Chinese whisper where you kind of pass it along from person to person, by the end, it's very different. So viruses are always changing. They're always mutating. They're always varying in terms of what letters go in what order. And the only ones that survive, i.e. the only ones that will become variants of concern, are the ones that have a evolutionary benefit. In other words, they are more infectious, or they cause, or they're able to spread easier. So those are the ones that actually we hear about, but it's happening all the time with all viruses, right? So that's an interesting thing that people should realize, is that variants will occur. And that is a concern because as certain rich countries vaccinate their populations, we think, oh, we're safe. But in reality, some countries, especially in Africa, have only a 5% immunization rate. So the virus is spreading rapidly in those ones, and the time to be able to mutate is still there. So what we want to do is make sure we vaccinate as many people as we can, as quickly as we can, so that we don't give the virus a chance to find a way past our defenses.
So essentially, when we take the vaccine, we're stopping a chance for the virus to make copies of itself and to change within our body, to mutate within our body. Whereas if we don't vaccinate somebody, or somebody isn't vaccinated, you got a chance because many people are going to get sick, and you're getting more of a chance for it to mutate and become another variant.
And I wouldn't say it's on an individual basis. It's on a population basis. Exactly.
Okay.
But your point's well taken.
And that's a question I had. One parent said, we look at our children, and we're looking at how COVID-19 doesn't affect the young people as much as an older individual. And said, well, why should I bother, vaccinating? And I told her, wow, you don't want that child to spread it to other individuals. Children can get really sick still with COVID-19, although it's smaller numbers. But also, you don't want the children to become a source where the virus could develop more variants. So you want to stop the virus in its track, and we need to make sure that anybody that can be vaccinated gets vaccinated as soon as possible.
Yeah, we got Tim asking about CBD or
Ooh.
THC in terms of its benefit with COVID, and there are some studies that actually show that it might reduce that cytokine storm that was occurring in most severe patients. But again, it's one of these things where, you know, the time to study and the resources put behind it aren't enough really to kind of get that definitive answer. But you know, the steroid uses, at first they weren't using steroid at the right, or they didn't know the right time to use it, right? Because that also reduces that cytokine storm. So are you going to see physicians or ICU doctors giving CBD to people, or marijuana in the ICUs? I don't think so. But again, you know, we're going to learn more about this virus and things that are beneficial and useful against it. I will tell you that I think we're going to see CBD used in a lot of different things moving forward in the next 5-10 years. That's a whole other topic that maybe we can do another time.
Yeah, definitely. All right, so here we are. Oh, no changes as of yet.
That panda.
It's time.
How do we dethrone panda? Or how?
They're all doing great. They're all doing great. True or false? Is this statement true or false? I do not need a vaccine if I've already had COVID-19. Is that true or is that false?
That's a good question, Bruce. I'm not sure I know the answer to that one, but I guess false.
It is false, right? We want people to be vaccinated, right?
Exactly.
No, I will not be dethroned. So Jen is apparently the leader right now. So essentially, and that's what I've been telling a lot of young people or people that have not quite been vaccinated, and some individuals that have had COVID-19, you should get your full doses of the vaccine. Couple reasons. You might have recovered, right? But your immune system may not be at that level that would protect you if the virus were to come back. So you might get sick a second time. And we got different variants. So you might have been infected by the alpha variant, and then you get the Delta variant inside of you. Your immune system may not be ready for the Delta variant. And guess what? You could get sick a second time. So you know what? Don't take a chance. Get the vaccine, and then you know you're covered.
Yeah, and we've seen people that have had COVID recurrently twice, so the antibody levels don't rise enough. We've also seen people that have been vaccinated that haven't risen. So if you have the opportunity to both protect against variants and raise your antibodies level up higher, may as well. I agree, Bruce. That's a great point.
Yeah, don't take a chance. Just do it. There we go. Oh, Arctic Panda is still on top. There we go. Everybody's doing great.
Yeah, everybody's doing fantastic.
All right, next question.
We're almost done, Bruce.
So which of the following health measures can you stop immediately once you receive your vaccine? You get vaccinated tonight or tomorrow. After you get vaccinated, you can stop wearing masks. You can stop physically distancing from one another. You can stop washing your hands, or really nothing changes. You keep following the same health measures. So which one is the correct one?
Now, what if you're the last person vaccinated on the planet?
How would you know?
Yeah.
So I guess because we are in Canada, the messaging has been quite consistent when it comes to this. We continue following the health measures. And frankly, Dr. Wright, can you explain very briefly, why do we need to continue this?
Yeah, well, it's really imperative that we continue doing it because you're protecting others, right? The vaccine protects you from getting COVID. In fact, did you hear about those IT people in Florida? There was a IT department in a government building, 6 people in the IT department. 2 died, 3 ended up in hospital, 1 didn't get it, and it was the one that was vaccinated, right? So it's key that we continue protecting ourselves, and we're doing it for others, right? So as herd immunity rises, in other words, as the majority of us get vaccinated, the wearing of masks, the washing of hands, and the physically distancing from one another can reduce. In fact, now it's starting to get to the point where if you're in a group setting with multiple dual vaccinated people, they are saying that you can take your masks off, which is, it's almost eerie in some ways. Like I know that we have, because I've been doubly vaccinated. I'm a physician. I work with COVID, and every now and then you look at each other and you go, hey, we've both been vaccinated. We
That's
can,
it.
have you experienced that at all?
I'm not double vaccinated yet, so
just single so far.
I still followed all the health measures.
Absolutely.
And us at Science North, we will be reopening to the public, and until the health unit and the medical officer tells us to, we will continue to wear a mask and following those health measures.
Now, can I ask a question? Does the beaver have to wear a mask?
No, the beaver doesn't have to wear the mask, but the porcupine does. And good luck trying to put a mask on a porcupine. You got to keep in mind also with us at Science North, we are going to have a segment of our visitor population that aren't going to be vaccinated. And those are the kids, right? Everybody under the age of 12. So we still need to follow those healthcare measures.
Very true.
I don't want to give it to them, and they don't want to give it to me, so on and so forth. So it's something to keep in mind. But you know what? I know we're all itching to not follow these anymore and get rid of the mask. But you know what? The public health officers and the medical officers in Health Canada will tell us when it's time to drop it. But for now, let's keep going.
Yeah,
we don't want a fourth wave, please.
Absolutely, but think, use that as a motivation. The more of us that get the vaccines, the sooner we'll be able to get rid of all these other things.
Excellent. Oh, wow.
Pandas are really moving it.
Yeah, they're really good.
Jen will not be dethroned.
Oh, what is herd immunity? Well, I think you kind of answered it, but it's okay. Is it immunity found in cattle against a disease? Is it people coming together in a large crowd to become immune to the disease? A large percentage of people developing immunity to a disease, or it's just something I just heard?
It is something we just heard.
Just heard. Yeah, I think everybody pretty much got it. Excellent. Yeah. So essentially is individuals that develop immunity either naturally because they got sick and they recovered, or vaccines, right? And if you got a whole bunch of us, then we stop the chain of transmission, right? The virus can't jump from one individual to another individual. And there's some of us that can't get vaccinated. We just can't vaccinate individuals. People are immunocompromised. People wear certain compounds of the vaccine. I know one colleague, her mother has blood clots, and she is allergic to PEGs. So unfortunately, she can't take the current vaccines right now. So there's some people that just can't get vaccinated. So if we got a lot of us that are vaccinated, that will stop the disease in its track as best as possible. Now, why it's called herd immunity? It's a term they give to cattle. That's where it came. They would vaccinate a whole bunch of cattle against a certain disease, and they called it immunity of the herd. Well, it kept going right now. Really, the term we should be using is community immunity. That's a better one. We're not a bunch of cattle, so that's kind of funny. All right, here we go.
Almost done, Tim.
Almost done. Wow, you guys are good.
Ooh, breaking the 1,500. 15,000 mark. I cannot get that.
Oh, here. Is this statement true or false? I cannot get COVID-19 once I get the vaccine. Is this true or is this false? I cannot get COVID-19. All right, it's actually false. Now, why do people get COVID-19 if they get the vaccine? I understand if you only got the first dose there and you're not fully immunized, but what could potentially happen even if you get your double dose? Because we get these what they call breakthrough diseases here and there.
Yeah, so you've got two reasons really at the end of the day. One is a variant that that sneaks by, and the other is you can actually have you didn't build enough antibodies. Mm-hmm. And I've had people in my practice, Bruce, that I've been giving hepatitis B shots for school, for example.
Yeah.
And one of the things we have to do afterwards is test the antibody level. Remember, you talked earlier about titers. Yeah. So to make sure the titers get high enough so that you have the immunity. If you don't, you have to vaccinate again. And there are people that just, for some reason, their bodies aren't building enough antibodies for that protection. And it's rare, but it happens.
Yeah, and we hear all these numbers, right? We hear the numbers of I think it's efficacy or effectiveness, like 95% for a certain vaccine or 70%, 80%. And what that's telling us is that, when you give the vaccine to individuals, 95% of those individuals, it will work. But there's still a small percentage of us, for whatever reason, may not work. So that's where, those individuals could potentially get COVID-19, even if they've been vaccinated. So keep it in mind, it could happen. It could happen to certain individuals. Excellent. All right. So, he's talking. Somebody's trying to distract you. All right. Well, so last question.
They're trying to get the answers from me. I'm not giving it to them.
Oh, all right. So this is probably one of the questions at the end. This is the last question. It's probably a really good one. All right. Here we go. So, which of the following statement is true about the vaccines? The vaccines will prevent you from getting really sick. The vaccines can give me or a person COVID-19. The vaccines will stop me from infecting other people. One shot of the vaccine is enough to protect me from COVID-19. There's only one statement that is 100% true, or very close to 100% true. Mm-hmm. Right? You're looking at that and thinking, there's two that people are writing, is it that one or that one?
It's a really good question, Bruce. Yeah. I like it. Yeah.
So we can say definitely that these vaccines protect individuals from getting real sick. So we were talking about individuals getting COVID-19 after, vaccine, and it's called breakthrough, disease, but they don't end up at the hospital. They'll recover, right? And we hear cases like that. The most famous one I could think of is the New York Yankees. There was a whole bunch of personnel. They got fully vaccinated, and out of 8, there's one that actually showed symptoms. The other ones didn't, and they were just they test, right? They test everybody, and they were like, I didn't even know I had COVID-19. So we can say, and that's what the pharmaceutical companies, when they test and they're testing, and you get these rates, 95% and 70%, whatever. What they're looking for is whether or not those individuals get really sick and end up at the hospital, and they're not seeing that. And
yeah, in fact, if you go to any hospital in the U.S. and you look in the ICUs, almost 100% of the time, you will find that they're unvaccinated people. Yeah. And it's sad because it really, truly, today, speaking of today, there is these deaths that are occurring are preventable.
Yeah, they're completely preventable. I know of a elderly lady. She's actually one of my friends. She lives in the GTA area. She's an elderly lady. She's a smoker. She has health issues. So she had her vaccine like months ago, and she went to a doctor's appointment. It was in a hospital. They tested her for COVID-19 because that was just standard procedure. 2 days later, they called her to say she had COVID-19, and she's like, Bruce, other than feeling a little bit underwear for a couple of days, I was fine. So even that one dose did protect her. And she's the one, and she tells me, I'm the one that gets every bug, every disease. And you know what? Knowing who I am, if I didn't even get that first dose, I would have ended up at the hospital with the tubes in my mouth, and I would have probably been one of those stats. And she's going to get her second dose soon. There, she has to wait a little bit. And so it was quite interesting. She told me their story and the whole bit, and it was like, wow, that's incredible. Even that one dose was great in preventing her from being real sick. Now, let's talk about that second one that people might have, like the other one. The vaccines will stop me from infecting other people. Do you have a comment about
that? Do I have a comment? Yeah, just that we more and more we think that it actually does stop people from actually infecting other people, but we don't know definitively at this time, and for 2 reasons. One is you can still transmit it, and that's called being a vector. Mm-hmm. So you can actually still carry it from place to place and person to person. But also, when you are vaccinated, as we talked about earlier, the penetration, your viral load is much lower. Mm-hmm. So you don't end up in hospital. Because when you end up in hospital, it's because the virus has replicated so high that obviously you're getting problems. But when it's low, we still could transmit, right? And that's why we're still saying that we're quite confident that that it can help prevent transmission, but we're not 100% sure that it can.
Yeah.
We have a question from Tim asking about, the last question he said before he goes, is there drugs interactions for specific vax manufacturers? And the answer is no. Vaccines, the only, issue you have with vaccines is if, as you mentioned, if you have allergies to any of the components of the vaccine, and those are asked every time I give a vaccine in my office. There's a very clear set of questions we ask, and if somebody knows they're allergic to polyethylene glycol, it's like, A, how do you know that? But B, it's like, you know it, so you're not getting the vaccine. If you've had allergies to previous vaccines, it's good to know as well, because then we might keep you for a half an hour, or we might not give it to you at all. But a lot of these are asked, but there's no list of drugs for each vaccine that says you can't get it. There's no interaction because it's affecting your immune system, and there's not an interaction like most drugs that you think of, like it's broken down in your liver, so you shouldn't take Tylenol with it, or you shouldn't take this other thing. Yeah.
Okay, that's good. That's a good point. And the other thing, and you kind of mentioned, is that when we do get vaccinated, we wait 15 minutes to half an hour, and if there's any severe reactions that were to happen, they would appear there, and you really want them. We don't want them to appear, but if they were to appear, you're in the best location, right? Because you have the healthcare professionals around you.
Yeah, we've got the epinephrine or adrenaline, depending on what country you're in, and we know how to treat it. So I've given thousands of doses, and we've had no problems. Some people get a little faint, they feel a little funny, but it has more to do with their fear of the needle.
Yeah,
in most cases.
Yeah, I've been telling teenagers because I've heard stories of teenagers fainting, unfortunately, because they get so worked up with that. If you don't feel good, please let somebody know. We'll just kind of keep an eye on you so you don't get hurt.
That's right.
It's just something. I mean, it's normal. It's something unusual. We've all been under high levels of stress. It's been an unusual, 15 months. So it's normal. It's normal that things can happen. And Tim asked about can they get their vaccine at your office? Keep in mind that the health unit have clinics every day. There have certain schedules in which people can get vaccinated, and I believe now they upped the schedule. I could be wrong. So look at the health unit website, and then you can actually
you can come to my clinic this weekend. We're having a walk-in Saturday and Sunday between 9 and 4. We have the Moderna vaccine, and we have 120 doses per day. First come, first serve, and you're more than welcome. We can chat a little bit more, Tim. Send your friends. The more people we get vaccinated, the better. And it is safe. It's effective. That's the key thing. It's effective. It works. And after having my second one, I feel it's been 2 weeks now, and I just feel like I can see the end of the tunnel here. It's great.
And I will say I'm really proud to be Canadian, because when I look at our vaccination rates and the uptake, and we've had walk-in clinics like last week with the health unit, and they had one and he ran out of doses in 2 hours. That shows that a lot of us are really excited to get this, because we want to move on. We want to be able to do stuff that we've done in the past. All right, so that was the last question. So let's see who's the winner of our Kahoot here. Excellent. So out of third place,
Silver Rhino.
Rhino, good job.
Expert Ibex.
And then top place.
Drum roll. Arctic Panda. That's Jen. Jen from Waterloo. You'll be getting your package in the mail. It's a T-shirt with Bruce's face on it.
No. You're not getting a T-shirt for me. Anyways, so I want to thank everybody that played and listened to this presentation. I hope that it has answered some of your questions. I saw a lot of you put some questions. I was really, really happy for that. Also, that for those that were unsure whether or not they want to get vaccine, that you now have the information to make your choice when it comes to vaccines. And frankly, the quicker we get our doses, and not just, the adults, but also the young people. It's important, that young people get it, and I'm talking 12 and up, and they get their 2 doses. I've done this type of session to high school students, to elementary school students, and I tell them, you know what? Get your 2 doses as quickly as you possibly want, because if you want to go back to school, you want to be able to do those extracurricular activities, well, those will only happen once everybody gets vaccinated. So, do you have any closing statements you want to finish off with, or?
No, it's been fantastic. It's been fun. Thank you very much for inviting me to Kahoot and learning more about how it works. And Science North is such a beacon of knowledge in the community. And I was once a blue coat. I worked with the environmental group, and I think it was in 1988, long time ago, Bruce, long time ago. And I just want to thank you guys for putting this on, and share the videos. Does this get recorded on YouTube so people can watch it afterwards?
Yeah.
Excellent. So we can share that with our friends. There is no conspiracy to control anyone. If you have an uncle that is telling you that, they're trying to control you, and it's not happening. I have 2 daughters that are within the 12 to 17 age. They've both been vaccinated with their first ones, and they'll be getting their second ones. And millions and millions of people are scrambling to get this, because it was foreseeable. The pandemic was going to occur. We just happened to be alive when it happened, and it's unfortunate. But let's get through it. Let's get vaccinated, and let's get back to enjoying ourselves. And
if you have any questions, we ask doctors, we ask nurses, nurse practitioners. They're the ones, they're the experts when it comes to the vaccine.
Yeah, trust the people that go to school for years and years and years and years and years, not talk show hosts that like their moment in the spotlight.
Yeah. So I usually finish off by saying, vaccines are really, what vaccines mean. It mean freedom, right? Freedom to be able to see our loved ones, our friends, to do stuff that we want to do. And the only way that we can reach that freedom is if everybody gets vaccinated. So please don't wait. If you feel comfortable, please get vaccinated as soon as possible. All right. So thank you, Dr. Wright.
Thank you
For this great evening. And thank you, everybody, for participating. And we'll see you next time.
Take care, everybody.